Hey everybody, Dr. Rouse here. Chances are if you're seeing this video, you were just in that chair right there, or one of our other operatories, and you probably got a crown or a bridge or some type of restorative implant done. I would just wanted to go over a little bit about the post-op instructions, the do's and don'ts, and the dental assistant may have gone over that with you, but it never hurts to have a video, right, to reference back to. So in my years of practice, the number one, number two, and number three thing to cause a person to come back in for a temporary is flossing. Believe it or not pulling down and through, but pulling up on a temporary will cause it to dislodge and fall off. So that would be the number one thing. The number two thing would be ice. So if you're an ice chewer, please don't do it until that permanent crown is put in and everything's in place for a while. Usually takes a couple days at least for that final cement to kick in. And then the third thing would be nuts or seeds or anything chewy like caramels. So if you can stay away from those things, and if you are ever in doubt, eat on the other side. Usually right after dentistry, our first meal that we're going to recommend is going to be something that you can drink through a straw. So a milkshake or a smoothie or something like that. And if you are in doubt, eat on the other side of your mouth. You can always take some Advil or Tylenol, ibuprofen, Advil, anything that you're comfortable with for pain management. We recommend staying ahead of that and making sure you try to make sure you prevent the pain before it happens, rather than waiting until you're hurting and then trying to do something there. And I recommend that you take at least 3 Advil if you're going to take something like that. So 600 milligrams. Don't just try to take 2 and hope that it works. It's not going to be enough. You can alternate Tylenol and Advil, so you're taking something every 2 hours. If you need anything stronger, please give us a call. If you think you have gum inflammation and need antibiotics or need a rinse or something else, give us a call. We might invite you to come back so we can take a look. If you're having sensitivity on your temporary, like hot and cold stuff, the number one reason for that is if the temporary is high. So if it's been a week, 2 weeks, and you're having sensitivity, it's probably because the temporary is high and you need to give us a call to get back in. If your temporary falls off, you can always use something from CVS called Tempatooth. We can, if you want to give us a call, we can, try to shoot you a picture of what that looks like. But just go to CVS, ask the people, where's your Tempatooth? And it's pretty easy. Paste you put in the temporary. You can use denture cream. You can use something to get it back on until you can come in and see us, and we can use some stronger stuff. But if you walk around with a tooth with no temporary on, and you're one of those people out there that's been blessed to have a high pain tolerance, sometimes you pay the price because when you come back in, the permanent crown won't fit. So we need you to give us a call. If your tooth had a root canal, chances are you're not going to feel the thing anyway. And if you have any other questions, give us a call, 972-885-9670. We really appreciate you being our patient, and I'm so glad that we got to work together. Any feedback that you have, we would love to hear that as well. And we look forward to seeing you for your crown seat or cementation with our assistant, who hopefully already booked you for that. And if you have a front tooth, we might give you a call to come in, stop in, and take a look at the shade before we go ahead and do that appointment for the crown seat, because we want to make sure that you're happy with the color. So that's just a possibility, and we might give you a call. Again, if you need anything from us, you can always email us, contact@Open Late Dentistry. Otherwise, we look forward to seeing you soon. You take care. Have a great day. Bye-bye.